A healthy citizenry is essential to building the wealth of a nation. Over the last few decades, investments in new innovations and collaborative action has helped many African countries tackle critical health problems. Across the continent, people are becoming healthier and living longer, and in turn are becoming more productive members of their societies. Now the global community has agreed to a set of ambitious goals, including ones focused on eradicating disease and improving the health and well-being of all. But we can't reach these goals using only the health tools we have today. We must embrace innovation, actively look for new, homegrown solutions, and focus our resources where it matters most. We need to be willing to invest in a healthier future. This is where research and development comes in. R&D enables us to find new and creative ways to tackle our emerging health problems. It helps us develop or adapt health technologies that are affordable and have the potential to transform health and societies. But with limited resources and competing priorities, is it worth investing in research and development? Let's take a look at the facts. Investing in health research and development saves lives. In the fight against HIV and AIDS, investments in antiretroviral therapies have resulted in a 44% decline in annual deaths from AIDS in East and Southern Africa in the last 5 years alone. Investing in health research and development saves money. For example, new vaccines such as the rotavirus vaccine, which was tested in South Africa, have reduced hospitalizations in children for severe diarrhea by up to 69%, which in turn reduces healthcare costs. For tuberculosis treatment, estimates suggest investments in a new advanced treatment regimen for drug-resistant TB could save South Africa $25 million per year and reduce treatment time by 11 months, so people will be able to return to work and become productive much sooner.
You don't need to invest tens of millions of dollars to save tens of millions of dollars. You can invest a small amount of money to save lots of money in some cases.
Investing in health research and development also creates jobs and helps economies grow.
It's well known in the developed world that one of the best industry creations is biotech. If you create one science job, you create 10 other jobs to service it.
However, in order for devices and tools to improve the lives of those who need them most, they must be affordable, accessible, and appropriate for the communities and settings in which they'll be used. It is therefore critical for all countries, especially those where the burden is highest, to invest in health R&D.
If you keep on being dependent on importing technologies, on waiting for other people to tell you what to do, you actually lose your own ability to manufacture. You start losing your researchers to international organizations, and in the end you cannot build homegrown solutions that will actually really make a difference.
We must harness the expertise and ingenuity of the African people and bring together governments, the private sector and civil society to identify and advance health technologies that will not only save lives but also grow our economies. The evidence is clear. Now the only question remains, can we afford not to prioritize health research and development?